Let's talk about what can have real impact on the effectiveness of the egg donation programs. Let's say that egg donation programs are programs where we use the good quality eggs from the young healthy ladies. So on this stage, let's say that we're interested in quality of embryo and quality of uterus and endometrial cavity. When we're talking about the quality of embryos, we need to be sure that the sperm is good as well. It means that the sperm sample should be normal on motility, morphology, and definitely concentration. Moreover, the sperm should be healthy from the point of view of immunological issues, and it should be excluded high rate of DNA fragmentation. When we're talking about the embryo quality, we're interested in both, in morphology of embryo and genetics of embryo. By means of good selection of sperm and eggs, we can talk about the good morphology of embryos. Definitely embryos should be corresponding to the Gardner scale. They should be very high quality. But beside the morphological quality, we may check the genetic quality of embryos by means of trophectoderm biopsy that we can perform on the 5th day of embryo's development. When we're sure in both the morphology and genetics of embryo, only after these we can say that yes, definitely this precise embryo is good from both morphological point of view and it healthy from genetics point of view. And this embryo may be evaluated as healthy embryo. Then let's talk about the lining, about the endometrium. When we put a healthy, completely healthy embryo inside the uterine cavity that is not prepared for the transfer, the most probably the pregnancy will not occur. So the endometrium should be synchronized. The endometrium should be prepared. The embryo transfer must be done in the proper way in the mid-secretory phase between 19th and the 24th day of the menstrual cycle, when it's the highest receptivity and when we presume to have the implantation window. The endometrium should be thick enough when we're evaluated it with the help of a regular IVF scan. It should be more than 7.5 millimeters. On the day of 1 day before the progesterone intake, it should be so-called triple line. The paternacy, it does not mean that in all cases the paternacy will be triple line. In case of homogeneous endometrium, the pregnancy may occur, but the percentage of successful pregnancy will be significantly lower. Then let's say about the intrauterine abnormalities or their absence. There should not be polyps, adhesions, septs, other disorders of the uterine cavity. It will be ideal not to have endometriosis or adenomyosis or fibroids in the uterus. So both embryo and endometrium should be ready. It will be better to check the endometrial receptivity for patients who never been pregnant before by means of ERA testing, when we can see the precise best period for the embryo transfer. So the cavity should be ready and the embryo should be good. This is two main reasons of implantation failure when talking about the egg donation cycles.